So as you may be aware, I am an aesthetic nurse. It may come as a surprise to you because I do also post a lot of things about other things, because I don't just do aesthetics, I do a lot of other things. So I'm going to try and section things out a little bit so people know where they are. So I'm going to do like something about Botox and about fillers, and I think what I'll do is I'll section it out into, like, say Tuesdays and maybe Fridays. So say Tuesdays I might call it, I don't know, TOX Tuesday or something, and then Fridays maybe Filler Friday, and then maybe do another day, say, about skin boosters, and then my other stuff will be on other days, then no one's getting confused. So I have done aesthetics. That is my main career. That is my main job. I've been a registered nurse now, qualified nurse for 13 years. I used to work in Bolton A&E for many years, and then I moved into doing aesthetics and Botox and fillers, and I did that part-time for a while until I built up a clientele where I had enough people where I could just come out of the full-time nursing and do my aesthetics full-time. Now, I did my clinic predominantly from my home clinic for many years, and then I opened my shop, and I've had this for about 6 years. I didn't always work here. Even though I had it, my daughter worked here quite a lot of the time, and I still worked from my home clinic. I just preferred it. I just preferred the home clinic environment. But when I moved from there a couple of years ago, I decided that everything was just going to be separate, and I was going to work from my clinic with the aesthetics. So that's a little bit of background about me if you didn't already know. So today we'll do a TOX Tuesday. So if you have any questions, the time to ask me about Botox will be on a Tuesdays, and then I can answer your questions about any area of the face or the body, or whatever you want to talk to me about, whether it's from people, clients, patients, or whether it's from people that administer Botox. I'm not bothered about the medic, non-medic thing. I will explain things to anybody if they want to ask me the questions and if they want to know. So I know I've done a lot previously on eyebrow positioning. So I think I'm going to do about lip lines today, which is a little bit separate than lip flip. So we've got two different things going on when we've got the lip lines, and we can have lip lines above the lip or under the lip. When we make an expression, so specifically when we purse the lips, so in order for you to differentiate whether you need filler or you need Botox, you just need to do one simple thing. If you go to the mirror, and when you're at rest, without pursing your lips, when you're at rest, if you've got deep lines here that are vertical, then you need filler. If the lines are only visible when you purse your lips like that, then we can use Botox, because Botox works on contraction of the muscle, and we have a muscle around the mouth called the orbicularis oris. We also have one in the eye called the orbicularis oculi. So they're like sphincter muscles, and they work in that way. I've got a picture here. So if you have a look, so this is the anatomy of expression. So this is the expressions that we make. So if we purse, you can see the light's not shining on it, the way that we pull, and that muscle pulls everything in. And if you remember, Botox works on muscle. So if we relax that muscle, usually we just do the top, but you can do the bottom as well. Usually, I think I'd usually tend to go with filler for the bottom one, because if you think that when we make facial expressions and we use this muscle a lot, so just some people say, I've never smoked, so I don't know why I've got these lines. You don't need to have smoked, which is why we moved away from calling it smokers lines to barcode lines. So you might see some people referring to that as barcode lines. It's because we spend a lot of our lives talking, eating, making all sorts of different facial expressions, and depending how strong this muscle is for you, or how much volume you've lost as you've got older, will determine to the extent how many lines that you have here. The way that we treat that is with just usually 4 drops of Botox. So just 1, 2, 3, 4, similar to the lip flip. In the lip flip, we tend to come more on the vermilion border with the Botox, but we can come in and we can relax the pull of the muscle. So that will help. So the side effects of that is obviously because we use this muscle to, say, hold on to straws and things. So if you need to do that, that's why you may get a feeling that this is not gripping onto things, because it can no longer contract as much. We only put a small amount in, because if we put large amounts in, you won't be able to move the top lip, and you're just removing your bottom, and you won't be able to drink, because you won't be able to clasp hold of your drink anymore. So that is why we can only put small amounts in. Botox and fill together are probably the gold standard for that, because if you have got volume loss, then you'll need to replace the volume. But we don't want to put high amounts of volume of fill around there, or else you're going to get that Homer Simpson duck mouth. So we only want to put small amounts, and I just go in with tips of the needle just around down the lines themselves with the tip of the needle. So aliquots, or whatever you want to call it, just little blebs of filler down that, and this seems to work fantastic for people. I don't go in with cannula under there, because you're just going to get a big puffy mouth. You're going to get a big puffy mouth. But Botox does work brilliantly for relaxing the contraction of those lines and wrinkles. Remember, Botox is only very short-lived. You're only getting a duration of up to 12 weeks. Some people a little bit longer, some people don't get as much as that. Here, you're probably not going to get as much longevity from that, because there's small amounts of volume. The bigger and the higher the amounts of volume that you have with Botox, the better the result. Usually on some people, now there's instances on that where you wouldn't want to put large amounts like the forehead in older people, but the bigger the volume in general, the better the result and the longer lasting the Botox. Hence why you may pay quite a significant difference between clinics, because it depends on the volume that they're putting in, and obviously the brand of Botox that they're using, because there's different brands of Botox as well. We don't use Korean Botox that's not licensed over here, because one, it's illegal, two, you don't know what that's mixed with, and you don't know how that's been imported into this country. So yeah, it might work well fine with some people, but if you keep using that 10 to 15 years, you'll probably find that at some point you get a fake product, and that can be devastating for some people. It can be catastrophic if it's mixed with things that you don't want it to be mixed with, and it reacts with your skin. It is not worth the risk, and for a few pounds less than what you're paying for the genuine stuff, it is just not worth the risk. That's my stand on Korean Botox. It's not licensed over, it's not legal, so don't use it. Anyway, that's Talks Tuesday. Let me know what you think. If you've got any questions, let me know below, and again, remember, I'll do things about toxin on a Tuesdays if you want to write me any questions about that. If you like the content, of course, like and follow below. My name's Sophie, and I specialise in cosmetic medicine. Like to know any more information about all aspects of Botox, fillers, skin boosters, facials, all that kind of thing, and facelifts if you want, because I've also had a facelift, so like and follow.